And thank you for tuning into today's webinar, The Art of Scenarios Using Real-World Scenarios to Teach Nursing and Soft Skills. My name is Emily Klinsky. I am on the marketing team here at Realityworks. Presenting today, we have with us Denise DuBois, our product manager, and Samantha Forehand, our marketing and communications manager. Denise and Samantha both have hosted numerous webinars and sessions on topics that cover family consumer sciences, health sciences, and soft skills that give educators ideas to bring lessons to their classrooms. So they're a pretty great resource for today's webinar. Before we get started, I do want to cover a couple things. First, today's presentation is being recorded and all attendees will receive a link to that recording, as well as the handouts that are mentioned today. You will see that email within 24 hours after the webinar. We will have time at the end for a Q&A session, so if you have any questions, please feel free to type them in the chat feature or the Q&A spot at the bottom of Zoom. So with that being said, I'm going to pass things over to Samantha and Denise.
Thank you, Emily. We are very excited to be presenting today. Denise and I have spoke on the topic of scenarios and soft skills at many conferences live and webinars, and each time we present, we learn something new within our chats with all of the attendees. So I highly encourage you to ask questions at the end, give suggestions, share ideas, so that we can all learn from each other about this really fun topic. So what will we discuss today? So first we're going to talk about the soft skills versus the hard skills, what they are, and why we really need to be focusing on the soft skills while we're teaching the hard skills. We're going to jump into ways you can use scenarios to teach both hard skills and soft skills and what those benefits are. Give you some ideas on creating your own scenarios for use within your own classroom environment and community. And talk about some new resources that we have at Realityworks, both some products that we create based around scenarios and some free resources that we have to offer you for being on this call today and visiting realityworks.com that can help you within your classroom. And finally, we'll do a question and answer session on this topic on Realityworks, and also a sharing session if you have anything to add. So soft skills and hard skills. So really, why do they matter? So using scenarios to teach hard skills. So first, hard skills are those technical skills we also need to do our job. In healthcare, it could be things like procedures that healthcare professionals perform. For example, certified nursing assistants might need to know patient bathing, and EMT definitely need to know CPR. Nurses, it could be injections. And now scenarios or real-world situations can be used to teach these skills within the context of those real-life situations, not just isolated to that hard skill that is needed to actually perform a task. So this is one example of how the CTE landscape is laid out visually. There are 16 career clusters and many pathways within each cluster. The clusters are where we teach the technical skills or hard skills. And the soft skills are really part of that foundational learning, kind of within that middle section, and the skills that CTE really can build on. So scenarios can be used within those soft skills and those hard skills and technical skills. Now, throughout our time learning about soft skills, we have done a ton of different research to really try to find out what is important when it comes to the soft skills in the workplace. And here's a few research things I wanted to share with you. So the first one is a study in 2013 done by Millennial Branding showing that 61% of managers think that it's very important to have great soft skills right within the workplace. In a poll conducted by CNBC in 2014, revealed that 44% of employers choose soft skills as the biggest gap within the US workforce. In research conducted by Harvard and Stanford Research Center, also concluded that 85% of job success comes from having well-developed soft and people skills, and only 15% of job success comes from those technical skills, knowledge, hard skills. Another study that I recently have been reading a lot on is something called Project Oxygen. This is a study that Google did on their own employees. They wanted to look at who their top performers were and what made them so powerful in the workplace. So what they did is they looked at these top performers, they did interviews with them and their coworkers, surveys, looked at past job reports on them, and why were they such top performers. And in the end, they came up with 7 skills that made them more effective than their coworkers. And the top 6 were all soft skills, and number 7 was defined as that STEM or hard skill within their job. So some of those top skills were communication, having empathy, being a coach, problem solver, and critical thinking, all soft skills. So it really does show that soft skills do matter for success within the working environment. So hard skills versus soft skills. There are so many sources of statistics that speak to the importance of soft skills. And here's another one. You can see 77% of companies say soft skills are just as important as the hard skills. And 16% of companies say that soft skills are even more important than those hard skills. So in our CTE courses, are we teaching soft skills as much as we're teaching hard skills? If you look at job descriptions, employers are often asking for a combination of both the technical hard skill as well as the soft skill. Both types of skills are definitely necessary to successfully performing and advancing in your job. And you might be asking, why are we focusing so much on all of these soft skill statistics? And really, we're looking at what employers want for their students to, for their new employees to really succeed in those jobs. And we also know that a lot of times educators tend to focus more on the technical skills because they have to teach those. And that the soft skills can be a little bit more elusive and difficult to teach. And where do you fit them in? But really, these can be taught and should be. So now we're really going to jump in and focus on some ways that you can use scenarios to teach both the hard skill and the soft skill within your environment. And before we get into those ideas and lessons, I did want to share that you can access on realityworks.com. If you visit the website link that you see there, that will take you out to all access to our guides and curriculum with our products. This really is our response to the current environment with COVID-19. And we wanted to share all of our product information to help you with some of that remote online learning that you're doing. In a lot of our curriculum within our health science areas, we'll talk about the teaching of the hard skill, but we always focus and add in patient focused information. So how you talk with your patients, how you incorporate that soft skill within that technical skill you're learning. So if one thing you take away from today is go out to that website and get that free curriculum. All right, so scenario-based learning. So there are so many different benefits to scenario-based learning, whether it be for technical skills or soft skills. First of all, scenario-based learning creates sticky learning environments, what that student is really going to remember about that learning experience that they had. It facilitates problem solving within learners, putting the students in new and different situations. It provides guided exploration to learners, giving students explicit and thoughtful critical thinking opportunities. It provides a safe practice zone to gain proficiency and mastery, really with no fear or risk of consequences, because they're in a classroom learning environment where they can learn from what they did through feedback, through working with other students, from you, the instructors. It's really a time for students to practice that before they're put into a real world situation, kind of to build that toolkit of responses and approaches.
Thank you, Sam. And now we're going to share some specific lesson plans and resources available to you for pathways like certified nursing assistant, nursing, and EMT pathways. These skills can be used in medical assistant and other pathways as well. And these resources will work there just as well. So health science has used the power of scenarios with standardized patients for years to help teach those key nursing skills. Now, sometimes your scenario will include the use of perhaps a simulator or a hands-on resource as well. So you can see a few examples here of two different ways to learn technical skills using simulators and scenarios. Now, the first photo is using a blood pressure simulator on a standardized patient. You can create any scenario you want and have one student be the nurse actually learning how to take blood pressure for a specific type of patient, and then students can switch roles. Now, the added benefit of a wearable simulator, such as this blood pressure simulator, is that the student is always practicing the soft skill of patient communication. Now, on the right, you can see a geriatric simulator or mannequin that can be used for a wide variety of scenarios to teach and practice all sorts of basic nursing skills. So you could set up a scenario with students working as CNAs, perhaps in a nursing home setting, and give them a scenario where they have to do those hands-on skills like performing a bed bath with the patient or even doing some peri-care. Now here's a few of the nursing curricula and lessons available to you that go along with our adult nursing mannequin. Now there's quite a bit here. There's over 10 different modules on a variety of different procedures. Now you have access to this at the link that we shared earlier in the webinar. Again, these lessons always have an introductory empathy scenario to work through, but then later in the lesson, there are procedures for each technical skill that can be used also to integrate into scenarios. Here are a few of the other lessons you have access to at the link we provided, but these are specific to EMT skills. Now, even though students wouldn't have access to those mannequins and those skills trainers, there's still value in the content provided in the lesson. So these are just a few of the lessons for those EMT skills that you have access to that you could also use in scenarios. So for all the lesson resources that we've mentioned, there are 3 sections in each lesson template. We have all of the health science lessons follow the same template. So once you use one, they'll all look familiar. We start out with a focus section. That's where you capture the student attention. Now there will always be some sort of soft skill focused empathy scenario in the focus section to kick it off. And later on, we'll focus specifically on that as a tool. But right now we'll also learn about the learn section, which is that middle section. And it's used to teach the main objectives of the lesson. And in each lesson, you'll also find procedures identified that can be used perhaps in a scenario to teach and practice the technical skill as well. And then we always end every lesson with a summarize section that reviews the key points and sometimes even includes short assessments and things like that. So here's an example of the procedures included in intubation. So this is just an example that happens to be an intubation, but for your scenario, you could use the task trainer or mannequin as the patient, and then the student works as the healthcare professional who's going to be performing the intubation procedure on the patient. Now, of course, in a classroom situation, you'd be using the checkoff above to ensure that proper procedures are followed in the scenario that the student is role-playing. However, students also will be role-playing using soft skills as well. Now, we know that right now, many of us are teaching online. Now, in that case, you could take these procedures, you could perhaps type them into another Word doc, or you could scramble the order and challenge your students to put them in the correct order. Now, in Google Docs, you could set this up so that each step has a correct number associated with it, so it could be auto-graded. And then finally, you could administer the brief review quiz at the end. So we know that hands-on practice really needs to be done in a skills lab for certain things, especially for something like this. So right now we're just trying to give ideas for how to get students all of the information so they can be ready to do those hands-on things and save time once you are back in person in the classroom. Now here's another example of using a procedure from the lesson in a scenario type of format. Now this is from our pressure injury curriculum, and it's a pressure injury assessment and documentation activity. So if you were in a classroom, you could use the mannequin and put the pressure injuries on it for students to do an assessment and documentation. Now, because that is not the case in our current learning environment, I'm going to show you a quick way for students to do this activity without these resources. So you could, of course, save this assessment worksheet in a PDF. You could then create a Google Doc, and I'm going to show you that on the next slide, where you would include the image of the patient, close-up images of several different pressure injuries that they, quote, find on the patient, the assessment handout, and then an area to document their findings in writing. And that, in effect, becomes the scenario. So here are the images of the assignment that I created quickly in a Google Classroom. I started out with a document that had the photo and the name of the patient. Then you can see the 3 types of pressure injuries that were present during the assessment. Now, the third part is where the instructors are going to have the students walk through the assessment as if they were in the room with that patient, following the procedures that they have in the lesson. And then at the bottom, there's going to be an area where you would have them actually document their findings. So by using this as their scenario, you can see that you could have them do a skin assessment on this patient. Now, here are some sources you can use for some free nursing scenarios. And there's so much more than these, but these were just some I found doing some quick searching. And the second bullet, which is SimCentral, if you click on that, there are literally 4 pages of sources to go to. So there's tons out there if you have the time to search, but hopefully this will give you just a starting point to save you some time if you're looking for a variety of different nursing specific scenarios. Now, for some programs that are looking for scenarios specific to the EMT pathway, here's a few places you could go. The first link is EMS training videos on a variety of topics. The second one is the NREMT scenarios. That's the certifying entity. They actually have a wide variety that you can do searching for by patient types, from adult, geriatric, and pediatric. And then the third link has dozens of scenarios listed that you can read and work through. So you can see how you could use some of these resources, even in an online setting now, to get your students critically thinking and working through and problem solving a variety of scenarios. So now that we've talked a little bit about the benefits of scenario-based learning for teaching, we want to specifically focus more on some soft skills. So we know that scenarios are a great way to role play or even provide critical thinking and problem solving opportunities for students. So here's one. To kick off our immobilization and splinting lesson, we have students read through and answer questions regarding a scenario that is meant to teach empathy and, of course, focus on that patient-centered care. Now, in a classroom, you'd have your students think, pair, and share. But online, we could post something like this as a reading assignment with those reflection questions as a written exercise. You could easily create an assignment in Google Docs by posting this scenario as the pre-lesson activity. You know, students would answer the questions and submit them for accountability. But we also always have answer keys available for ease of use for instructors for our scenarios as well. So to kick off our patient bathing lesson, we have students read through and answer questions regarding the scenario that's meant to teach empathy and focus on patient-centered care in a bathing scenario. So you can see how you could, read through this, have your students read through this, and then you could use these questions also as discussion. If you have a discussion forum in your LMS, if possible, this could really provide thought-provoking written activity as well. So if you're looking to teach a unit perhaps on patient-centered care and empathy specifically, at the link we provided earlier, combination of all of our health science lessons, there are probably up to 20 to 25 different scenarios to be found in our health science lessons, all relating to empathy, and all of those scenarios focuses on a different topic. So it might be a rich source for you to go to. Now, wearable simulators can be used in scenarios, and they're a great way to teach empathy and other soft skills such as patient communication. So here's just a snapshot of some of the wearables we have that teach empathy. Now we have a geriatric simulation suit, our pregnancy simulator, hemiplegia simulator, and also a trio of hearing impairment, arthritis, and a visual impairment simulator. So, and of course, all of the curriculum lessons that go with each of these products do include scenarios. And again, you can access all of those scenarios at the link provided at the beginning of the webinar. So now we want to share some tips for using wearables in scenarios to teach soft skills. First of all, number one, encourage group interactions whenever possible so students can build off of each other's experiences. Using stations is a good way to implement a variety of experiences to rotate through when you're in a classroom situation. It certainly makes classroom management a lot easier with less wait time for students. Consider assigning students a specific role to play at each station, like that of the patient and that of the healthcare worker, so that they have a chance to experience the conditions and then experience helping someone with that condition. Now, if you're in an at-home learning situation, as many of us are right now and finishing up the school year, we've also recently done a webinar that gave instruction for how to do 3 at-home do-it-yourself geriatric simulation experiences. And we did record that webinar, and it is archived under the webinar part at realityworks.com. So if you are looking for 3 lessons that you can deliver online, integrating home simulation experiences, that would be a great place for you to go to. Now, one very simple yet effective way to help students learn a variety of soft skills are with our pathway scenario cards. Now, each of those cards is written by a subject matter expert. So each card focuses on a different soft skill. So there's 19 different soft skills. Each scenario includes things like points of view to consider and key discussion questions. So for health care sets, we have nursing, we have geriatric, and we have EMT scenarios. And we're going to share one scenario from each of these pathway sets with you that you could use immediately in your class. So the first one is a nursing scenario focusing on time management. And any nurse can tell you how critical that skill is in a clinic or a hospital setting. So I'm just going to read it quickly. Ethan, a nurse on a surgical floor, has 5 patients, and he is 1 hour into his shift. 2 patients have just come back from surgery and need frequent assessments. Another is receiving blood, which also needs to be monitored. He reaches out for help from the nursing assistant, but she is too busy. He hasn't been in yet to check on the other 2 patients who need their morning medication. So you would share this scenario with your students, and then they could answer those key questions. Now, one way you could use this is a wrap-up or a review activity at the end of a lesson where you've introduced and focused on time management. Those key questions are really important to helping students apply those time management skills as well as critical thinking. And these are things that you could definitely post in an online learning environment. Now, here's an EMT scenario focusing on patients. Any EMT can tell you how critical that skill is in the field. So I'm going to read it quickly. Mrs. O'Grady is well known in the EMS system. She's an 83-year-old widow with a history of angina and COPD, but also has admitted that she's very lonely without her husband, and she enjoys talking with the handsome EMTs who respond to her home when she calls 911. Dan and Toby receive a dispatch for a female with difficulty breathing and recognize Mrs. O'Grady's address. It is the 4th time in 24 hours that they've responded, and she was cleared from the hospital each time. She is in no obvious respiratory distress and admits she only called 911 so she could talk to somebody. So another way you could use this could be as an introductory scenario when you're kicking off a lesson on patients as well. So there's, again, a lot of different ways that you could use something as simple as a scenario like this. And then our third pathway is a scenario regarding geriatric care. Now, this would be a perfect scenario if you have something like a certified nursing assistant course or even a health occupations career exploration class. And, you know, sometimes it's fun to have students try their acting skills. So you could have them read this communication scenario, and then you could assign students to the different roles of the person in the scenario and actually have them act it out in front of the class if you are in a classroom setting. And then after the scene is done, then you ask those key questions to generate a class-wide discussion. Now, if you'd use this online, you can have your students role play the healthcare provider and then use family members to be the other actors. We know that they love to use those cell phones, so they could actually video it and then submit it to you along with the answers to those discussion questions. So I'm going to turn it back to Sam to talk about creating your own scenarios to use.
Okay, so Denise gave us some great resources. Realityworks offers some great pathway cards, but you might just be looking for, how do I build my own? Where do I start when creating a scenario? So some sources for creating scenarios. First, when you look at writing these scenarios, don't think you have to do it all yourself. Really look at who around you could get involved in writing scenarios. The first one I always suggest is getting industry involved. Maybe you have advisory boards for your programs, or you know somebody who has advisory boards, or talk to local employers. Ask people within the industry that you want a scenario on to just write up a situation that they have experienced. So the situation could be something with a patient, something with a manager, and just list out what was the scenario and what happened. Have them write that for you, and then you as the instructor could come up with some of those critical thinking questions that your students could then answer. Another thing you could do is get your students involved. You know, some of them may have life and work experiences that would work really well in this, whether it's specifically career related or if it's related to just a interaction communication with somebody else. They might be able to write their own scenarios that you could then use within your class. Talk with your colleagues or talk with your family. Everybody has some real life situations that they faced that put them in a difficult situation. Ask people to write those out for you, and then you could incorporate some elements of industry specific skills or situations or hard skills that might be needed as well within that situation. And the other thing I always say is research it online. Just simply Google workforce scenarios, workforce conflict situations, role playing within the work. And a lot of different options pop up that you could then take to incorporate real world scenarios right into your classroom or into your online learning. Now, Denise shared some great resources for health science specific scenarios, but there are so many other general workplace scenario videos out there as well. YouTube is a great source. Just think of a couple keywords and you're going to find a dozen different videos. So some things we looked up was conflict in the workplace, managing conflict in the workplace, dealing with communication issues in the workplace. A lot of these videos are going to be much more a general workplace conflict or situation or scenario, but they're really effective for the students to kind of see what could be happening in a workplace. So what you could do is you could find these videos, play it, pause it, and then have your students either answer together, do a writing exercise of what is the scenario, what's the situation, how could it be handled better, differently, or what would you do if you were in those shoes? All of those things are really creating those sticky learning experience and really getting the students into the shoes of an actual person within the workplace. Now, here are just three additional links of really good scenarios that I had found that I just wanted to share. And as Emily said, we'll be sharing this presentation out with you. But the three that we found, they're fairly short situations. The first one is work scenarios with coworkers. The second one is conflicts in the workplace. And the third one is workplace ethics. So these are, again, those general soft skill scenarios, not specific to healthcare, but also just a great way to get students thinking about how they're going to interact, critically think, problem solve, all within the workplace. Great video opportunities for you. So some new resources that teach both the hard skill and soft skills that we're offering at Realityworks. This is a new product series that we brought out this year that we wanted to share with everybody on the webinar. So they are called our Nursing and CNA Skill Sim Kits. And really what these are is they're a kit that are going to include 3 different scenarios within each kit, focusing on a specific topic that's going to give students multiple opportunities to work through a simulation exercise. It's exposure to related scenarios on a single topic that's going to reinforce those student skills and content learning. Each of these kits includes, like I said, those 3 different workplace scenarios, as well as a variety of props that are incorporated to make the scenario even more realistic for that learner and that participant and that observer, to really get them to understand that situation that they could be put in. And also each kit does include a pre-brief and a debrief exercise to encourage that critical thinking, problem solving, and other soft skills within a real world situation. So here are the parts that are included in each of the sim kits. So what we see these, or how these are being used, is instructors could assign the same scenario to the class and have everybody rotate through these different scenarios. They could also assign it to a variety of small groups with different scenarios, or use that scenario as an assessment piece or a skill to mastery. You can look at the group of students. If it's a small group, maybe assign somebody to be the role of the patient, somebody to be the nursing professional, and somebody to be the observer. And they can go through this 10, 15, 20-minute scenario and kind of observe how each person reacts, and then switch places. And again, really the discussion after the scenario is done is that key part to get the students really thinking about how they could have handled that situation different. What went really well? What is something they should remember to do in the future? And what's something they could work on as well? So creating that fun, sticky learning environment in a place where they can make mistakes. So some additional resources from Realityworks, some free resources out there. Wanted to share a few more with you. The first one is our webinars. So we offer a variety of webinars right on realityworks.com. It's going to be latest product information, program best practices, tips and tricks from users. All of our presentations are led by either product managers, curriculum specialists, product support technicians, really subject matter experts that can give you some good in-classroom learning information, whether it's tips and tricks or product information. We have a variety of information out there that's free. All of our webinars are recorded and posted out there at realityworks.com/webinars. And we've really been focusing on a series over the last couple months for online and remote learning. So I encourage you to go check out our webinars that are listed and see what information you can gain for online learning, and maybe take parts and pieces for classroom learning. And other additional resources, Realityworks has a great blog that has customer stories and information, again, those tips and tricks that are out there. And then I encourage everybody to friend us on Facebook, follow us on Twitter. We're always putting out promotions, ideas, free guides, free webinars. It's really a way to stay incorporated in Realityworks. And if you have any of Realityworks products, we have a great product support team as well to help you through using those products. So at this time, we are going to just open it to questions. Encourage you to use the chat feature, and Emily can go through those questions and we can answer those now.
Yeah, we got a lot of good questions. So one of the ones that keeps coming up is, are they going to be receiving a copy of the PowerPoint?
We certainly can add that if along with the email where they'll get the link to the live recording of the video. We can certainly add that as an asset as well. So yes, we would be happy to share that.
Awesome. And then due to the COVID-19 crisis, do you feel that healthcare agencies will rethink their emphasis on 18 years old?
That's a tough question. I don't know. I guess it'll be a wait and see. It very well may. I just don't know.
And then we have, is there any mental health nursing scenario kits?
Not yet, but that is something that we are actually working on in product development right now. So I'm really happy to hear that there's interest in that. Stay tuned, because we are actively working on new things all the time, and that is part of a new product that is actually in development right now for 2021.
Will agencies open themselves up now because of the strong need for healthcare workers?
Boy, that again, tough one. I don't even know that we know that. Sorry, I can't even offer an answer on that one. And
then Denise, so for our scenario kits, what are the age ranges that these are geared towards?
The skills sim kits are really meant for high school to post-secondary. Some of our pathway scenario cards, though, could be certainly used as low as middle school for some career exploration scenarios. If they would like to try those and see how the students do. But anything that teaches more of those technical skills along with the soft skills are truly geared to more high school and post-secondary levels.
Okay, and then how do students make videos of skill mastery if they lack resources to demonstrate?
That again, another really good question. I know ACTE on June 2nd is going to be doing, June 1st or 2nd is going to be doing a webinar on a similar topic. And that is something that I think that schools are grappling with on a local basis even. How do you equitably teach those that have that have the access versus don't. And I don't have a crystal ball, but I think that those are answers that are going to have to be reached in the next few months, because we may have more schools not going back to in-person instruction in the fall. And this spring we just reacted, but by fall we have to have more of a plan. So I think keep watching for articles, for webinars, for training opportunities that address that question, because I think more will be coming.
And then how do we move forward in the virtual world that is now our reality? Does Realityworks have any resources for home delivery?
Sam talked about the webinars. We've recently done a series, I think we've done as many as 8 or 10 different webinars on taking Realityworks, certainly our curriculum assets, and how to use them in an online learning environment. And we recently transferred all of our Realityworks Real Care Baby curricula specific to Google Doc friendly classroom materials. So, and those are all available on our website. So we're moving more toward that. We're trying to provide information to help people use certainly some of the lesson plans and activities and things. The very nature of CTE and health science and allied health fields is hands-on learning. You can't get away from it entirely. I mean, there are some skills you just have to be in a classroom to practice, or you have to be around a patient or using a simulator. So we can teach online up to a certain point, but then you've got to have that hands-on eventually. So, you know, how it manifests itself in the fall, it might be somewhat of a combination, but the best we are trying to do is help get as much information, ideas, and activities out to you to use with students in a remote or online environment, so that when they are back in the classroom, you can really maximize and use that time to your greatest advantage for those hands-on learning opportunities.
Awesome. And then we have a good one here. Do you think that soft skills scenarios would be better presented as unfolding, or have them do them over the whole scenarios and then have a Q&A session in a group environment?
I think you could try both ways, and you might experiment and see which works better for the content that you're trying to teach. I think there's room for a lot of different ways to creatively use soft skill scenarios that way.
And then we have somebody that has the geriatric simulator, and they're wondering if they can use that for all their health science classes.
Oh, absolutely. Any health science pathway where you may run into working with an aging adult, a geriatric patient someday, there's value with that geriatric simulation suit, because you put it on as a wearable and it transfers students immediately into 10 different common conditions of aging. And that's the best way you can help students understand what that could be like if you've got a patient like that someday. But it's not even working with patients. Maybe many of us have aging parents or other relatives or neighbors. You know, you're going to be working with or having in the workplace and just in society around you, you're going to be interacting at some point with older adults. And we think that there's value across the board for anybody to go through an experience like that, but certainly in healthcare, because the aging of our population and baby boomers, we're running into that population more and more on the job.
And with regards to the geriatric simulator, where can they find the 3 lessons for remote learning?
They can find that a couple different places. First, the link that we shared earlier gives you access to all of our curricula. And if you scroll down under a geriatric specifically, there's a button for that. You will find them there. Also, if you want to go to the webinar that we did, it was delivering content online from our geriatric curricula. So that has been archived and saved at our webinar button on our realityworks.com. And you can also watch that webinar.
And then do we have any scenario cards for purchase?
We do. We have 11 different pathway specific sets that you'll find on our website store. And we also have 2 that would be considered more generic scenarios, which include a variety of workplaces and types of scenarios. And those are generic sets that go with our employability skills program and our leadership soft skills program. You can also purchase those, just the scenario card portions, for use with your students.
All right, it looks like that is all of our questions. Oh, Have you worked with colleges of pharmacy in the past?
No, that is one area and pathway that we have not done a lot with. We certainly have seen more and more programs moving pharmacy tech down to the high school level. So that is one where we are hungry to explore. But sorry, right now we have not done much with that area so far.
And then we have, are you working with the district CTE department to purchase for each academy?
We have account managers that are assigned states as territories, and they are actively working with all levels of customers, schools, and academies for purchases right now. So if you are wondering specific to your school or district or building, reach out to your administrators and see and check to see if they are working with our account managers. And if not, please reach out. We would love to connect.
And then we have, will there be more developed on the occupational therapy side?
Yes, we have a series of new products in development, hopefully for 2021, that will be launched, and some of them fall within that area. So again, stay tuned for 2021.
Yep. And then our last one, is there a range of costs for the geriatric wearables?
Yes. If you go on our website store and you click on each of the individual wearable products, you will see the pricing right on the website. So in each one varies in price. You've got the geriatric simulation suit that you can look at. We've got the hemiplegia simulator, that's a wearable. And then we've got the geriatric sensory impairment kit, which is the trio that's tremor simulator, arthritis, and hearing. So all of those are wearable experiences specific to geriatric.
And then do we have case management / care coordination?
No, that is not an area we have anything on right now.
Okay, and it looks like all of our questions are answered for today.
Well, terrific. Well, thank you again for participating. We really appreciate you taking the time to spend the last 45 minutes with us. And we hope that you find some of these ideas regarding teaching with scenarios useful and helpful. And if you have any questions regarding anything, you see our 800 number on the screen in front of you. You can email or call, but we would be delighted to talk to you more about any questions that you might have. Thank you very much, and have a great day.